Bismillah ar-Rahman ar-Rahim. This is lecture number 3 from the part of drugs used for treatment of anemia. It is related to the groups of drugs for a blood disease. Anemia is defined as a low plasma hemoglobin concentration resulting from decreased number of circulating red blood cells or an abnormality low total hemoglobin content per unit of blood volume. So it came from two types, either decrease the number of circulating red blood cell or from low total hemoglobin content, although the number of red blood cell is normal. General signs and symptoms of anemia include fatigue, rapid heartbeat, shortness of breath, pale skin, dizziness, and insomnia. The rapid heartbeat came from that the blood cannot giving enough oxygen and nutrient to the tissues and cells because of the anemia. So rapid heartbeat will compensate that decrease in the efficiency of the red blood cell in order to give the required nutrient and oxygen. Anemia can be caused by chronic blood loss, bone marrow abnormalities, increased hemolysis, infection, malignancies, endocrine deficiencies, renal failure, and number of other disease states. All those types are due to chronic blood loss, and others may cause anemia. A large number of drugs cause toxic effect on a blood cell like hemoglobin production or erythropoietic organ, which in turn may cause anemia. This will be taken in detail in the courses of toxicology. Nutritional anemia. It is caused by dietary deficiencies of substances such as iron, folic acid, and vitamin B12, which is cyanocobalamin, that are necessary for normal erythropoiesis. Individual with anemia that has a genetic basis, such as sickle cell disease, can benefit hydroxyurea. This disease, sickle cell disease, is of genetic origin, while the first one, which is anemia, it came nutritional anemia, it came from deficiency in diet. At all, anemia can be at least temporarily corrected by transfusion of whole blood, because the whole blood can given a shifting for the blood cell in order to maintain deficiencies in the oxygen and the nutrient, so temporarily correct the anemia by the whole blood transfusion, but the causes of anemia doesn't repaired. Agent used to treat anemias. We started with iron. Iron deficiency results from either acute or chronic blood loss, from insufficient intake during the period of accelerating growth in children, because you know that children when they are grow fast more than the adult, faster than the adult, so they need iron more than the adult. And in heavily menstruating or pregnant women, those women will lose blood in large quantities, so they need also to compensate for the iron. Thus, iron deficiency results from a negative iron balance due to the depletion of iron stores and or inadequate intake. Suffering from hypochromic microcytic anemia. This is occur due to low iron and small size red blood cell. So the body cannot maintain the deficiencies because the amount of iron taken is less than the amount which is consumed by the body. In addition to general signs and symptoms of anemia, iron deficiency anemia may cause PK, which is mean hunger of eyes, dirt on paper. Those children will be noticed to be eating dirt, eating dust, eating paper. Sometimes they eating strange things. It is called PK. It is called PK. While koilonychias, which is the upward curvature of the finger and toenails, also can be accounted as a sign of deficiency of iron. And soreness and cracking at the corner of the mouth will also occur. Supplementation with elemental iron correct the iron deficiencies. They recommend 150 to 180 mg per day of oral elemental iron. Oral elemental iron. This is administered in divided doses 2 to 3 times per day for patients with iron deficiency anemia. Why we said oral elemental iron? We said that because iron came in the salt form in the tablet and it contained a different concentration of oral elemental iron according to the type of the salt which is be present in that tablet. Pharmacokinetic. Iron is absorbed after oral administration. Acidic conditions in the stomach keep iron in the reduced ferrous form, which is the more soluble form. Iron is then absorbed in the duodenum. That means the ferrous form is more soluble than the ferric form. Some extended release formulation may dose once daily. This is a benefit for the some type of extended release like extended release capsule or extended release tablet. Ferrous sulfate is the most commonly used form of iron due to its high content of elemental iron and are relatively low cost. The percentage of elemental iron varies in each oral iron preparation. We see this table which gives us an idea about the characteristic of various iron formulation. We see different type of salt of iron formulation. I want to remember the one which have a red arrow with it, like ferrous sulfate. It contains about 20% of elemental iron. That means each tablet that contains this type of salt of iron, ferrous sulfate, contain about 20% of elemental iron. 20% of the tablet is an elemental iron. It is a good percent, although it is low, but it is still a good percent because those patients have severe anemia may laterally benefit from this concentration of elemental iron. The note that most common oral iron supplement, it is present in the form of ferrous sulfate and low cost with good effectiveness and tolerability. This type of tablet is advantageous about that. And the second one I want you to remember, this type also is the ferrous fumarate salt. Ferrous fumarate salt of iron, which contain another higher amount than the ferrous sulfate, which is 33% of the tablet contain elemental iron. It have a similar effectiveness and tolerability to the ferrous sulfate, and it is almost noticed compared to other type of salt. Parenteral formulation of the iron, such as iron dextran, iron sucrose, and sodium ferric gluconate complex are also available. While parenteral administration treats iron deficiency rapidly, oral administration may take several weeks. The physician will use those iron injection for the severe cases of anemia, and this type will lead to starting to heal the patient more rapidly than the oral route, but sometimes the oral route is administered also. Adverse effect: gastrointestinal disturbances, which is caused by local irritation. This is causing abdominal pain, constipation, and diarrhea, and others, and dark stool are the most common adverse effect of an oral iron supplementation, while parenteral iron formulation may be used in those who cannot tolerate oral iron because the parenteral iron have no gastrointestinal side effect. Fetal hypersensitivity and anaphylactoid reaction can occur in patients receiving the parenteral iron, mainly iron dextran formulation. This type of injection may cause severe hypersensitivity or fetal hypersensitivity cases. A test dose should be administered prior to iron dextran in order to avoid the fetal hypersensitivity. Excessive iron can cause toxicity that can be reversed using chelators like defuroxamine. Now we came for a second type of vitamin, which is called folic acid or folate. Folic deficiency may be caused by, number one, increased demand, like cases of pregnancy and lactation; poor absorption, which is caused by the pathology of the small intestine, where a small amount of folate will be absorbed; number 3, alcoholism; and number 4, treatment with the drugs that are dihydrofolate reductase inhibitor, for example, methotrexate drug, pyrimethamine, and trimethoprim. In the later cases, the reduced or active form of the vitamin folinic acid, also known as leucovorin calcium, available as an oral and parenteral formulation, is used for the treatment in order to avoid the side effect of those drugs that decrease the folic acid. A primary result of folic acid deficiency is megaloblastic anemia, which is a large-size red blood cell, and it is caused by diamine synthesis of purine and pyrimidine, which are used for the synthesis of those type of vitamins. Those will lead to affecting the synthesis also of the DNA. Notice that to avoid the neurological complications of vitamin B12 deficiency, it is important to evaluate the basis of megaloblastic anemia prior to instituting therapy, because both vitamin B12 and folate deficiency can cause the similar symptoms. So we have to differentiate: is this type is due to vitamin B12 deficiency or due to folic acid deficiency? A second type of vitamin, which is cyanocobalamin and hydroxycobalamin, which is called vitamin B12. It came in two types, cyanocobalamin and hydroxycobalamin. The deficiencies of vitamin B12 can result from either low dietary level or, more commonly, poor absorption of the vitamin due to the failure of the gastric parietal cell to produce the intrinsic factor. This intrinsic factor will be produced by the parietal cell. It is called pernicious anemia when this factor is absent, or a loss of activity of the receptor needed for the intestinal uptake of the vitamin. Sometimes the receptor have no activity to pick up the vitamin and absorb it, so it is also the causes of this type of anemia. In patients with bariatric surgery, which is a surgery that are used to decrease the weight of the patient, the vitamin B12 supplementation as cyanocobalamin is required in a large oral doses, because the vitamin B12 will be absorbed from the GIT and a large part of the stomach may be gone to a surgical removing of it. The concentration of vitamin B12 absorption will be decreased more. Vitamin B12 deficiency anemia may cause tingling, which means pins and needles in the hand and the feet, difficulty in walking, dementia, and in extreme cases hallucination, paranoia, and schizophrenia. The vitamin may be administered orally for a dietary deficiency intramuscularly or deep subcutaneously for pernicious anemia. So it is used by different types of route. The cause of megaloblastic anemia need to be determined in order to be specific in terms of the treatment. We have to differentiate the absence of the vitamins in order to give the treatment. Therefore, megaloblastic anemia should not be treated with folic acid alone, but rather with a combination of folate and vitamin B12. Therapy must be continued for the remainder of the life for a patient suffering from pernicious anemia because of the continuous deficiencies in those vitamins. This vitamin is non-toxic even in large doses. It is because it is a water-soluble. Erythropoietin and darbepoietin. This is another type of compound that affect the anemia in the body. Peritubular cells in the kidney will work as sensors that respond to hypoxia and mediate synthesis and release of erythropoietin, which is a glycoprotein. Erythropoietin will stimulate stem cells to differentiate into a pro-erythroblast and promote the release of reticulocytes from the marrow and initiate of the hemoglobin formation. So we understand from this that erythropoietin is a control site for the synthesis of the hemoglobin from the bone marrow. Erythropoietin thus regulates red blood cell proliferation and differentiation in the bone marrow. A human erythropoietin, which is called epoietin alpha, produced by the recombinant DNA technology, is effective in the treatment of anemia that are caused by end-stage renal disease. Because those patients who have a renal disease, they will have less erythropoietin. Anemia associated with a human immunodeficiency virus infection and anemia in bone marrow disorder and anemia of prematurity and anemia in some cancer patients. So we see that this type, which is epoietin alpha, is used in different type of anemia due to different reasons, but all of them will have the same thing, that it has low erythropoietin. These agents are generally well tolerated, but side effects may include elevation in the blood pressure and arthralgia in some cases. The recommendation for all of the patients receiving epoietin alpha or darbepoietin include a minimum effective dose that does not exceed the hemoglobin level of 12 grams per deciliter, and the hemoglobin should not rise by more than 1 gram per deciliter over 2-week period. They will start to increase the dose according to the level of the hemoglobin in each patient. They will do that to monitor the patient to avoid the toxicity and the side effect of this type of treatment. Now we came for another type of anemia and which drugs are used for it. They are agents that are used to treat neutropenia. Myeloid growth factor or granulocyte colony stimulating factor such as filgrastim, and also granulocyte macrophage colony stimulating factor such as sarigramostim will stimulate the granulocyte production in the marrow to increase the neutrophil count and reduce the duration of severe neutropenia. These agents are typically used prophylactically to reduce the risk of neutropenia following uses of drugs that are a chemotherapy and bone marrow transplantation. Bone pain is a common adverse effect with these agents. Agent used to treat sickle cell anemia. We have hydroxyurea, the first agent. It can reduce the frequency of painful sickle cell crisis in sickle cell disease, and the drug apparently increases the fetal hemoglobin level, thus diluting the abnormal hemoglobin S. Side effects of this drug hydroxyurea include bone marrow suppression and cutaneous vasculitis. The last drug here we have pentoxifylline. Pentoxifylline is a methylxanthine derivative that have been called rheologic modifier. It increases the deformability of the red blood cell and improves the erythrocyte flexibility and reduce the viscosity of the blood. It is indicated to treat the intermittent claudication in the beginning, but it has some study that it is used in the sickle cell anemia. Adverse effects are mainly gastrointestinal in nature and are lessened by administration with food. If you have a question, you can write it in the electronic side of the college in the Google Classroom, and I will be glad to answer them. Thank you very much.